Hello, I'm Dr. Kelly Feighan from PHMC's Research and Evaluation Group with my colleague Lola. We're going to present on evaluating PHMC's Public Health Campus on Cedar, lessons learned and considerations for the path forward.
Hello, I'm Dr. Lola Al-Uqdah, the Director of Community Research Engagement, and this is part one of a two-part series.
The purpose of this presentation is to share with you some background findings from an evaluation that we conducted on PHMC's Public Health Campus on Cedar and with the surrounding community. We hope that this stimulates some ideas and conversations that you and your colleagues or fellow community members might have as you're thinking about Cedar and its services. And near the end of the talk, we will offer some recommendations for continued inquiry in your thinking and just the exchange of information that we hope happens as a result. Specifically, we'll be highlighting findings from some interviews that we conducted, a group model building presentation that our colleagues from Drexel University School of Public Health conducted, some patient intercept surveys, and a community survey with 510 respondents in Southwest Philadelphia.
In February of 2020, Mercy Hospital in Philadelphia announced that it was closing. It would have been the second hospital closure in Philadelphia in a year. To prevent yet another hospital closure, 4 institutions joined forces to save the hospital: PHMC, the University of Penn Med, CHOP, and IBX. They formed an innovative public health campus. IBX funded the R&E group at PHMC to evaluate this initiative. Year 1 was a planning year, and year 2 was a baseline evaluation. Drexel University Dornsife School of Public Health was our evaluation partner.
So what's in a name? Lola mentioned that the PHMC Public Health Campus on Cedar rests on the site of 2 former hospitals and possibly many more, but Mercy Hospital and Misericordia Hospital in the past. So one of the themes that we saw across the key informant interviews was that people refer to Cedar by different names depending on their perspective, whether they work there, they work at Penn Medicine or PHMC or CHOP, etc. So people who work at Penn Medicine, for example, call the institution Huff Cedar, and folks from PHMC often call it PHMC Cedar or Cedar Campus. In the community surrounding the public health campus site, people who are familiar with Mercy or Misericordia Hospital sometimes refer to it by fairly negative nicknames because they've struggled and had a very difficult experience there in the past because of its negative reputation. And we just wanted to be mindful as we conducted this work that saving a hospital from closing is not for the faint of heart. So any kind of innovation like the one we've seen at PHMC Public Health Campus on Cedar means that there are going to be benefits and challenges. Course of our evaluation, we noted several successes at the PHMC Public Health Campus on Cedar. One of those successes was just in the major service area additions over time, such as adding a dental clinic, a medical respite, and crisis response centers. We also saw over time the building or strengthening of partnerships between Cedar staff and community-based organizations and foundations and working with the city of Philadelphia. We also saw that Cedar staff hosted more than 50 community-facing outreach events every year. They're very busy. They work with an auxiliary club, they work with a community advisory board that produce newsletters and a lot of really rich and interesting community events that are held with residents who live in the catchment area of Cedar. We also saw specifically that a lot of these events, often directed by PHMC's Director of Community Engagement, were very forward-thinking and designed to create a very vibrant space for the community. So there were job fairs during the time that we evaluated. There were food giveaways, holiday events, tabling to get the word out. Of course, there were challenges as well during the time that we evaluated. There were lots of construction activities, lots of dust around that key informants through the interviews we conducted had shared with us that made working and being a patient at Cedar kind of a messy experience sometimes, or loud. Much of the construction has been completed, some is still ongoing, and that's just the challenge in renovating an existing space. There were initially very difficult fiscal and contractual kind of negotiations from a business perspective because the partnership involves 3, sometimes more, huge organizations in the city of Philadelphia. There were some stalled collaborations that just petered out because they were great ideas, but maybe the business line couldn't afford them. And there were sometimes IT issues in the early days of Cedar operations where there were problems with some connectivity and using filings, sharing medical records and filing systems. And there was a lot of leadership and turnover in staff over the 2 years that we evaluated the campus.
What we know is that where someone grows up affects their health. Structural inequalities contribute to poor outcomes, and place-based initiatives can affect change by addressing these structural inequalities on a systems level to impact the community as a whole. The goal of this evaluation is to measure the extent to which integration of services on Cedar leads to improved health outcomes for community residents. More specifically, we intend to evaluate the effectiveness of partnerships, patient navigation, and service integration. We plan to use a place-based evaluation over time to measure the utilization of services, changes in the referral process, the level of collaboration between partners and between partners and the community, as well as changes in health outcomes. What we have accomplished thus far. Year 1 was a planning year, and year 2 was the evaluation. We collaborated with the Director of Community Engagement and utilized the pre-existing ties to the community to identify key internal and external community stakeholders. These stakeholders form the Evaluation Committee and the Cedar Research Advisory Board. The Evaluation Committee helped plan and conduct the Representative Community Survey, the Intercept Survey, group model building, and other activities. The Cedar Research Advisory Board helped to identify research studies to be conducted on Cedar's campus that are of benefit to the community and feasible to PHMC.
So next, I will describe some findings from our key informant interviews. We conducted 31 key informant interviews with members of the Cedar community and who worked there and might have been key decision makers for a variety of perspectives. When we analyzed the interview data, we were very heartened to see that there was a shared perspective between Cedar staff and members of the community with regard to some of their hopes and dreams for the Cedar campus. For example, a lot of people told us that they wanted more information about Cedar services. Even folks who work at Cedar would like more information from other partners. Penn, CHOP, PHMC, there's room for some more information sharing across those partnerships. Likewise, people wanted more information about the characteristics and needs of Southwest Philadelphians, especially those who are planning services. They'd like to know more about what the community needs. Everybody was very happy to have such reputable players involved in Cedar. Penn, CHOP, and PHMC are three large organizations and employers in our city. People wanted and thought that community was, serving as a vibrant community hub. They wanted to see more of that. People told us at the same time that there were lots of pressing needs in Southwest Philadelphia. In regard to mental health, a lot of unmet needs. There's a psychiatrist shortage that people were concerned about, food insecurity. So there were a lot of similar pressing needs that people identified, whether they were from the community or worked there, which is a good sign that the Cedar staff are aware of the community's needs. A lot of people across the interviews also defined what success would look like for Cedar, and they thought of that as high quality care that meets people's needs, has a positive impact, and is all around comprehensive for members of the community. Now, there were some areas where in our interview respondents offered different points of view depending on whether they worked at Cedar or lived in the community. Or led in decision making. So for example, we noticed that Cedar leaders were concerned about business aspects, how to keep things viable financially. So they talked about financial costs of operating in some of those interviews. We could see through the interviews also that some service lines were busier than others. The ER was pretty hopping, but some other units within the campus were not really at capacity, and that could be a problem down the line. Also, we noticed through the interviews that there was a little bit of a discordance or divergence between the services that were being provided and what some community members would really welcome in the future. So there's always a need to continue the dialogue between community and leadership at Cedar. So the interview respondents shared very innovative ideas with us about what they'd like to see happen at Cedar in the future. And fortunately, some of those ideas have come to fruition. For example, people would love to see a new pharmacy. They would, and I believe there is a working pharmacy at Cedar as of this pressing. Others mentioned maybe there's a gun buyback session that Cedar could arrange with members of the police force in Philadelphia. There could be concerts out on the lawn when the main courtyard is open and thriving. There are food pantry events that can and have actually been held, and maybe even a director of services is needed to share information across partners and for the community as well. We did see some implications from these interviews. One was, please, Cedar, share an organizational chart when you can. And also, folks would welcome more statistics about the community.
Talk a little bit about our Intercept survey. We conducted an Intercept survey of 80 adults. We wanted to know how Cedar versus non-Cedar patients perceive their experiences at Mercy and Cedar. What we found was that current Cedar patients were more positive about their experiences at Cedar than former Mercy patients. 62% of former Mercy patients were satisfied with their services at Mercy, while 76% of current Cedar patients were satisfied with their services at Cedar. We also wanted to know what types of services were most utilized at Cedar and why some respondents chose another healthcare facility versus Cedar. The ER, primary care, referrals, and mental health services were the most utilized. Respondents chose another facility because the needed services were elsewhere. They were more familiar with another facility, or their PCP was elsewhere. Interestingly, 50% of respondents believed care was better elsewhere, and this may have to do with a lack of trust. I'm going to talk a little bit about our results from the Cedar Representative Community Health Survey. of 2024, we conducted a representative community health survey to measure the awareness of Cedar, level of trust in staff in Cedar, satisfaction with Cedar, and the health status of community residents. We conducted a push-to-web survey. We sent out a letter with a $1 pre-incentive and instructions. To spread the word about the representative survey, we met with block captains, attended community events, posted flyers and door hangers. We also implemented a number of other measures to boost response rates, and we also texted willing respondents offering incentives for referrals. We wanted to understand Cedar service usage, the demographics and health conditions of the community. And so what we found was that 17.6% of respondents or family members received services, yet 22% of respondents who were aware of Cedar did not use Cedar services. The most highly utilized service was the ER, and the ER referred out about 20%. Primary care was the second most utilized services, and dental services were underutilized at 5.5%. Typical demographics were about 54% women and 41% male and less than 5% non-binary, primarily African American, and 46.1% were ages 35 to 64. In terms of chronic conditions, over 50% had high blood pressure, and less than 25% have ever had asthma. We asked what 3 factors contributed the most to your trust in Cedar, and what services were you interested in if offered. We found that health provider skills, safety and cleanliness, and personal experience were the top 3 factors that contributed the most to trust in Cedar, and resource referral, nutritional education, financial planning, and legal support were the services most interested in by community members. We asked, were you aware that Cedar opened at the former Mercy Misericordia site? And were you aware of the services offered at Cedar? We found 60% of respondents were unaware of Cedar operating at the former Mercy Misericordia site, and respondents were unaware of various services at Cedar. 62% of respondents were unaware of the ER room, 72% of respondents were unaware of primary care, 69% of respondents were unaware of mental health care, 84% of respondents were unaware of dental, and 83% of respondents were unaware of hospice. About the 60% of respondents who were unaware that Cedar was currently operating on the former Mercy Misericordia site. Was it simply that they were unaware of Cedar, or now that they know about Cedar, will they utilize services? For those who were unaware, we asked what was the most common factors that would influence willingness to try Cedar. And health provider rating was the top rated. Interestingly, health provider skills was also rated highly as one of the top 3 factors that would contribute the most to trust in Cedar. However, facility reputation was also rated as one of the top 3 factors contributing to trust in Cedar. The same group of respondents, when asked what services are you interested in receiving at Cedar, nutritional education support, resource referral, financial planning, and legal support services were the top services mentioned. Some suggestions for consideration based on our evaluation findings. 1, trust, shared vision, and inclusive decision-making are factors that are critical for partnership building. Resources, governance, and infrastructure. ensuring that there are adequate financial and in-kind resources are necessary for capacity building. Identifying common indicators are necessary for data sharing among partners with different IT structures. Community asset mapping, community-based organizations, community advisory boards, and research advisory boards are necessary for community-based participatory research methods. And maintaining a culture of continuous learning and improvement through research is critical as you move forward with an evaluation of the Cedar campus.
Thank you for watching. This concludes part 1 of our evaluation summary of PHMC Public Health Campus on Cedar's 2-year evaluation efforts. Next up is a video from Drexel University that describes group model building activities, cross-partner data sharing, and their creation of a neighborhood-focused data dashboard. Thank you for watching.